We're all at Fun and Sun for just that, fun and sun. Unfortunately, health emergencies happen infrequently. Residents have taken it upon themselves to buy and make available a defibrillator for heart issues. The defibrillator is located in a cubby in the carport of J11 at the corner of Stanley. You can access the defibrillator without resident assistance. Our professional health residents held a training session March 14, 2023. For those who couldn't attend, or for anyone looking for a refresher, here's the training.
Okay, so you get the defibrillator, you just unzip it.
I'd already unzipped it.
And then you just press the green button.
This is hard to do, holding on to this whole thing.
Well, you can pull it out.
Generally,
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
Scissors,
Remove protected cover and take out white adhesive pads.
they're here, right here. You just pull
When patient's chest is bare, remove protective cover and take out white adhesive pads.
There we go.
And see, each one shows you where to put it.
Look carefully at the pictures on the white adhesive pads. Place pad exactly as shown in the picture. Press firmly to patient's bare skin.
This one is over here.
When the first pad is in place, look carefully at the picture on the second pad. Peel the second pad from the yellow plastic liner. Place pad exactly as shown in the picture. Press firmly to patient's bare skin.
Okay. See, they got
Picture's right on there.
picture right there.
Okay.
Right there.
No one should touch the patient. Analyzing.
Okay, nobody touch, they're analyzing.
No one should touch the patient. Shock not advised.
Yeah.
The shock not
Before
advised.
emergency medical services have been called, it is safe to touch the patient. Check airway. Check breathing. Check circulation. If needed, begin CPR. For help with CPR, press the flashing blue button.
Okay,
Pinch nose, tilt head, and give 2 full breaths. Breathe.
You can't do it on yourself.
Well, Jen, get up there and do it.
But you're doing a good job.
Center of the chest, between the nipples. Place your other hand on top of the first. Push the chest down firmly 2 inches. Keep time with the beat.
so it even talks you through how to do CPR.
Good.
That's great.
Yeah.
Yeah, but it
Pinch
did.
nose, tilt head, and give 2 full breaths. Breathe.
Okay, if you don't wanna, that's why this is here, you can blow through this, put this over their mouth and blow through it so you don't have to touch their mouth or, you know, it's
Unless they're good
safer.
looking.
Pinch nose, tilt head,
Okay, I
Good looking, you wanna make sure you take the clothes off.
Because you gotta keep that up until they get there.
right. You keep this up until the EMTs get there. That, and then they'll tell you whether it's a heartbeat or no heartbeat. Return to doing CPR, and then in a minute or so, it'll say, analyzing, don't touch the patient. It'll keep doing
I heard
it.
something say do it to the paramedics, and I didn't think you were gonna shock
No,
them.
but CPR, you would do that till the paramedics got there. She's wondering what to do if there's a pacemaker.
You can place the pads, but I wouldn't, it's not gonna recommend a shock.
Yeah, you'll place the pads, but it'll tell you not to shock. It's
Because
not
the
recommended.
pacemaker is already- If
Will
the
it pick-
pacemaker's not working, then it might, but.
Will it pick up the pacemaker that it's in there?
Yes, it picks up that the pacemaker's in there.
Right.
Anybody can use it, and you're covered under the Good Samaritan law.
Just something important, when you're going to do CPR, you should have the person lying on a hard, flat surface, not standing up because you can't. It just doesn't work. So and of course, you don't want to throw them down, but support their head. You're going to need to do, if you need to do breathing, you need to have their head someplace safe, and just put them on the ground is probably.
Are you supposed to push hard enough to break their ribs?
No.
I've heard it both ways.
To go down to
2 inches. You press in 2 inches.
Push down,
Or-
it's just a couple inches
Will
and
somebody show
reload.
us?
If you start hearing ribs crack,
Well, unfortunately, for some people in this age group, the ribs are going to crack because their bones are brittle.
Yeah.
And it's going to happen, and it happens anyway. There's not a lot you can do about it. But the most important thing for doing CPR is making sure that you're actually getting the heart compressed enough to push the blood up to the brain, because that's what needs to happen. It needs to get to the brain.
Where are you going to press exactly?
Did you show us anything?
The breastbone.
You want to go right here, right between the nipples. So right here, you're going to put the heel of your hand right there. You don't want to be too low because there's something down here called the xiphoid process. And the xiphoid process, if you break it, you can cause major damage. So you want to be high enough. So right in between the nipple line here, put the heel of your hand there. Grab with your other hand and hold these up, and then push with both heels of the hands like that. That's why you want to be on a flat surface to get enough pressure. So you're like this, and you want to keep your elbows, basically keep your elbows locked.
Yeah.
So that you can.
Okay, sometimes I've done CPR.
So that you can get, and it's a pretty rapid pace too.
Yes, Steve.
One other recommendation, you want to line up as many people as possible because this is an exhausting exercise,
Yes,
so
it
that
is.
you can relieve immediately.
Yes.
yes, we're on foot.
Yeah.
Well,
Because if you're waiting, trust me, if you're waiting 7 minutes
That's a long
for the EMTs to get there, that is an eternity if you're doing CPR. It really is. 1 minute is long enough for most people, but to do
yeah,
it-
and around here, usually there's people wandering all over, so you just yell for help.
And hopefully there will be other people around that can call 911 and before you even start any of this, call 911 for sure. That is
Yeah, call 911 first. Now, everybody should have the defibrillator phone number in their phones. I've had people say, oh, I've got it on my refrigerator. Well, that's not going to help if you find somebody laying on the ground outside when you're walking. You need to have the phone number saved in your phone.
What is that number?
93.
Wait. You have to use area code?
Yeah. Well, yeah, because your phone
Yeah.
maybe doesn't have.
It's 956-320-9878. Oh, she's saying sometimes they're very sweaty and that. And then, so you would need to wipe it down, like when you're taking the shirt off, wipe off the chest before you try to put the pads on, if they're sweating.
How many compressions do you do if you have to give CPR?
15 and then 2 breaths.
Okay, 15 and 2 breaths.
And
Cribbage.
the machine,
Yeah, the machine was telling you,
Okay.
follow the heartbeat, and then,
and you're trying to get 100 compressions per minute, so it's fast.
it's fast, yeah.
It is fast. It will count it for you.
Did somebody else breathe?
Well, they can if you've got.
If you've got somebody else with you, you can have one person doing the breaths and one doing the compressions, and then switch off every minute.
This is gonna sound like a dumb question, and I'm not saying it to be funny or anything, but the anatomy of different people up here on the chest, I don't know how to ask this.
If somebody has their heart backwards on the right side instead of the left?
No, that's not quite what
He's
I'm
talking
going.
about female versus male.
Right.
Yeah,
Or some
okay.
people with large breasts. You do have to make sure that the pad is under the breast. So you want to lift them up and stick it on there. You know, it's not an embarrassing thing.
No, you're talking life and death situation.
Yeah,
That's right.
And if you want to lift my breast and stick that thing on there so it can shock me, go for it.
I've
I'm
got your
serious.
permission.
Yeah, yeah.
Yeah.
But it's,
Yeah.
you know, it's not.
If she's unconscious.
It's not
If I'm
important when it comes
unconscious
to
and
life.
I need to be shocked, I wouldn't be averse to someone doing CPR on me or using the pads. So if you think about it as you're saving somebody's life, and it's not a, you know, it's not a sexual thing or any weirdness. It's just you're saving this person's life.
You do what you have to save somebody's life.
Whatever body parts
That's
you have to
placing the
touch.
pads there. What about the pressure? I mean, there's some people that
Well,
are more,
You're not going to have. I mean, if you're doing CPR on somebody like, say, Arnold Schwarzenegger, you're pushing really hard because there's lots of muscle and there's lots of. I mean, it's a big solid chest.
yeah.
If you're doing something CPR on somebody like Karen, you're probably not going to want to push as hard because it's 2 inches on is a lot easier to get to on someone much smaller and thinner and, you know, less muscle mass.
I never know how you would know 2 inches.
Yeah.
You
estimate it.
You're estimating and
That's all you can do.
That's all you can
and
do.
it,
If you accidentally break one of the ribs from the sternum, they're not going to die. They'll be sore, but they will thank you later.
yes, they will crack.
There's
If
a couple
they-
times I have cracked ribs, and there's sometimes I haven't.
And if it saves their life,
They're going to thank you later.
This is a high stress.
Defibrillator walk you through that?
Yeah.
it does.
It'll
It
tell
does.
you
It
if you're
gives you-
getting a heartbeat again.
Yes.
This is
Yes.
a high stress situation for you if you're doing it.
Yes.
You are going to be trying to do your best. So just remember the training and go.
Yep.
Sorry, Debbie. I came late, so you might have covered this already. The defibrillator number, does that prompt someone to bring the defibrillator?
Okay, can you dial the number?
What I'm getting at is, does someone at the scene need to direct someone to go get the
Okay, it's
defibrillator?
calling.
Oh, okay. No, the
You
way
put the area code in?
Yes. If there's more than one person, yes.
Okay.
Did you get it?
Unless, either that person stays there or
There's my
you go
phone.
get it, depends on if they know where it is.
It goes off on anybody's phone?
No.
Just the group. So if
As I said, Babs, it rings on her phone, it rings on Sue's phone, it rings on my phone, rings on Claire's phone, it rings on Sarge's phone, and it rings on Richard's phone.
All at the same time.
All at the same time. If we're not in the park, we don't answer it. If we're in the park, the first one, you answer the phone, it says, are you willing to accept the call? You press 1, and then you're talking to the person that's calling. We ask, where do you need the defibrillator? And have you called 911?
so would you bring the defibrillator to
Yes.
me? And then, okay.
Yeah, one of us 6 would bring the
Whoever
defibrillator.
answered
And
the
then
call,
you get to
right?
use
was
it.
ready.
Yeah,
You automatically go,
Yeah.
grab it, and go to where you need to go.
In the
Yeah.
meantime, you start
TPR, yeah.
Okay.
And you should have already called 911 and have them on the way.
It's a lot easier now that we all have cell phones.
Yes, it is. And again, as I say, if something happens and you're near J11, don't bother to call us, just go grab it.
Yeah, you can grab it individually. You don't have to call us to get it.
If you have someone with you.
If you have somebody
Yeah.
with you, yeah.
The pads are just used one time, we
No,
replace
but I
the
mean
pads.
shock. It only shocks you
no,
once.
it will.
No, it'll keep shocking you,
If it needs it.
yeah,
The
if you
name
need it.
tells you, and then after you've done several rounds, well, listening takes a long time, but after you've done several rounds of CPR, it will say analyzing. So stop CPR, and then take your hands off the patient, and then it will analyze and see if there's a heartbeat again. If there's a heartbeat again, then it won't shock you.
But if there isn't, it's shock.
If there isn't, it will say shock recommended,
Oh.
and then it will say ready, and then you push the red button.
See on the bottom of that, when it says a shock is required, everybody get your hands off the patient and then you press that red button. The lightning bolt.